The U.S. has once again topped its daily coronavirus death toll. The virus claimed 4,000 American lives on Thursday, and more than 274,000 new cases were confirmed. This comes as the president-elect says he has a plan to get more people vaccinated. Manuel Bojorquez reports from Miami.
4,000 COVID-related deaths were reported in one day, and it will likely get worse.
The clouds are only going to get darker and darker.
Dr. Michael Osterholm, part of the incoming Biden administration's coronavirus task force, is talking about the new, more infectious strain found in at least 8 states.
It is going to get much worse before it gets better.
Pfizer and BioNTech announced their vaccine appears to protect against the new strain. Today, President-elect Biden said he would speed up vaccine delivery by releasing all available doses, rather than holding back the second dose the approved vaccines call for, going against FDA guidance.
I'm committed to get 100 million shots in people's arms in the first 100 days.
But production would need to ramp up to supply enough second doses. So-called mega distribution sites are being set up in Texas, New Jersey, and Pennsylvania. In California, military teams are now helping some overwhelmed hospitals. And in New Jersey, 25-year-old Army veteran Joe Dalton and his wife Melissa shared their cautionary tale. He caught COVID, but was considered too young and not sick enough for a hospital bed until it became a medical emergency.
Joe, what's that like for you to feel like you came that close?
I had actually woken up in a dark room with an intercom in it. The intercom and it told me, "Good morning, Mr. Dalton." And I swore to you, I was dead. I thought I was talking to God.
Here in Florida, Hard Rock Stadium, a COVID test site, became the first vaccination site run by the state. Officials are hoping to give out 1,000 doses a day over the next week. Lana?
So proud of those healthcare workers. Thanks, Manny. Dr. Dara Kass joins me now. She's an ER doctor and a medical contributor for Yahoo News. Dr. Kass, thanks for being with us and for all the work that you do. So let's get right into it. The U.S. recorded more than 4,000 deaths on Thursday alone. It's the highest single daily death toll that we've seen, and the numbers are still expected to get worse. What concerns you the most at this point?
We are in a void of federal leadership right now with an exponential rise in cases. We have a historic number of hospitalizations and deaths, and there's not a lot we can expect to change over the next month. Once the Biden administration comes in and really starts to have uniform messaging, starts to support the states and really bring back science to the forefront of our policy, we'll start to hopefully see these cases come down. But right now we are in a very precarious place with the spread of virus after the holidays and really a run on hospital beds and resources that really means that most of us should stay home if we can.
Health systems across the country are overwhelmed, particularly in Arizona, California, Florida, and Texas, where hospitals are said to be on the verge of rationing care. What exactly might that look like, and what kind of difficult decisions will doctors be forced to make if their facilities reach that breaking point?
So when we talk about rationing care, we really talk about saving the resources we have for those that we can do the most good for, the lives we can save. And hopefully in each of those places, administrators, doctors on the front lines are coming together to make decisions in a panel form ahead of those decisions having to be made for patients. So what happens is you get a list of recommendations, patients that maybe you would want to reserve the oxygen treatments for, the ventilators, prioritization, and then other patients that you would offer other, alternative care, whether it be to send them home and, have comfort care or other reasons why, because you don't think there's a high likelihood of them surviving no matter how much care you give them. The most important thing for patients to know is that this can stop. We can get back the resources we have as long as patients stop getting infected from this virus. So if we want to save all the lives we can, we need to stop the spread of this virus.
So switching to the vaccine, new research suggests Pfizer's coronavirus vaccine can protect against mutations that are found in the British and South African variants. What more do we know about this, and how likely is it that the virus could mutate into a new variant that would require an entirely new vaccine?
So we always expected that this virus would mutate. It's been mutating since it joined us almost a year ago, and viruses mutate all the time. We also know that this vaccine and all these vaccines were developed against multiple strains of this virus. And so we expected this to happen. It is good news that they have proven that the Pfizer vaccine is does work against this new variant, and we expect it to continue to work for other variants that come forward. But there likely could be a time where the vaccine stops working. We have to tweak the vaccine a little bit for whatever the new variant is. Remember that viruses replicate with the speed by which they infect new people. And so the best way to stop new variants is to stop the spread of this virus. That's one of the reasons we're seeing these mutations, is because it's spreading so overwhelmingly in our communities.
And President-elect Joe Biden says that he aims to release every available dose of the coronavirus vaccine when he takes office, in the hopes of speeding up these vaccination efforts, which we know have lagged. I'm wondering if you think that this could help. And as you heard in Manny's package, this is actually contrary to the FDA's recommendations. I'm wondering, with your perspective as a doctor, is this a good idea or a dangerous one? Is the problem with the vaccine rollout the available doses, or the capacity of the system to get those shots actually into the arms of the people who need it the most?
So I think that the problems are actually across the board. What we're hearing from the Biden administration is that they are going to release all these doses in anticipation of having the next dose available. They are not calling to delay the second dose like they're doing in England. What they're saying is, we're not going to hold back the doses we have, because we're also going to work with companies to increase production. What they are saying is we have to get as many people vaccinated as possible right now, and then work to keep that distribution channel open. What I hope to see, and what I expect to see, is a partnership with industry and local governance, with states, to get those vaccines that last mile into the arms. And that's the gap that we have been seeing with this current federal administration, is just the apathy about that last mile and whether or not people actually get vaccinated after the vaccine is delivered to states.
Well, I am so grateful for you for coming on and for continuing to push for those vaccines actually getting into people's arms. Dr. Dara Kass, thank you.
Thanks for having me.